Hi everybody, Dr. Daniel, and today I'm talking about, does oxygen work for cluster headache? Well, cluster headache is called suicide headache for good reason, because it is the most severe headache known to man, and it occurs in 0.3% of the population. Affected victims have described it as like a nail, like a needle, like a hook, like a rod in my eye. Medical treatment for cluster headache needs to be very fast, but because the headaches come on very quickly and oral drugs take too long and won't work. Two of the triptan class of drugs are recommended, and the most commonly recommended one, probably most successful, is subcutaneous sumatriptan, 0.6% injection subcutaneously, and also a nasal spray, zomatriptan, both of which work quickly in 10 minutes, but there's need for another acute therapy option for cluster headache. Oral triptans are too slowly absorbed to work, and triptans should be limited to 2 treatment days a week, and triptans taken over 10 days a month can lead to medication overuse headache, and persons with cluster headache may have 8 headaches a day. Because of the speed at which a cluster headache reaches peak and the frequency and severity of attacks, a pill to relieve cluster headache doesn't work fast enough to stop the headache, and injections of sumatriptan or nasal zomatriptan are expensive, given how many headache attacks cluster sufferers get per day, and these triptans are not recommended to be used more than twice a day. So does oxygen work for cluster headache? Oxygen treatment delivered at the onset of the headache via a rebreather oxygen mask is very effective for acute therapy of cluster headaches. Oxygen therapy works quickly, usually in 5 to 15 minutes. Side effects. Oxygen therapy is safe and has no important side effects. Speed of onset of cluster headache versus migraine. Cluster headaches come without warning and reach a peak in 2 to 15 minutes, but a typical migraine without aura attack may take half an hour to several hours from onset to peak. This rapid onset of cluster headache attacks demands rapid treatment if anything is going to work. Safety. High-flow oxygen is safe and highly effective treatment for cluster headache attack. It's just oxygen. We breathe it. For those who need treatment, oxygen is a safe, economical treatment void of worry about developing medication overuse headache. Important side effects are long-term iatrogenic medical problems. Administration. Oxygen needs to be given via a non-rebreather mask that keeps oxygen flowing in but disallows carbon dioxide to build up. Oxygen treatment is usually effective in less than 10 minutes and has no risk of cardiovascular symptoms like the triptans all do. Cluster headache patients also typically have a high use of smoking cigarettes, which add atherosclerotic cardiovascular disease to the mix. Flow rate. Effective use of oxygen for cluster is given at a speed called a flow rate, between 6 and 15 liters per minute, much higher than the typical oxygen that's used given patients for pulmonary or cardiac disorders. Use of a nasal cannula, which inserts in the nostrils via a nasal cannula, doesn't supply enough oxygen to work. That's the reason why a non-breather mask, which lets oxygen out but doesn't allow the accumulation of CO2, needs to be used. The prescription the doctor writes should be for the following, and I'm just going to list them: a non-breather mask, a regulator to determine the amount of oxygen flow, an oxygen tank with a wheeled cart for transportation. The tank may be refilled every month or as needed, and the mask and regulators may be added to the refill price or bought separately. Related questions. How does oxygen work for treating cluster headache? The pathophysiology of how oxygen treats cluster headache is not clear, and treatment may relate to the fact that oxygen can cause a decrease in arterial flow of the blood to the brain, and cerebral vascular artery constriction. What's the success of oxygen treatment? Oxygen is a safe, economical treatment for persons with cluster headache and is free from problems with medication overuse, serious side effects, or long-term harm. What are the problems in using oxygen? Doctors don't write the prescription for oxygen treatment properly. Oftentimes, doctors write O2 to be delivered via regular, non-breather either mask or nasal cannula. These modes of oxygen delivery don't give high enough levels of oxygen to work for cluster headache. Insurance cover for oxygen is poor, as only about 65% of insurance agents will cover oxygen for treatment for cluster headache, and Medicare and Medicaid do not provide any coverage. Some persons may buy impure non-medical grade oxygen, which is more cheaper than medical grade oxygen, but it has impurities in it, and one should not do that. What treatments for cluster headache have been endorsed by authorities? The answer to this question resides in the article, Treatment of Cluster Headache, the American Headache Society Evidence-Based Guidelines, written by Matthew Robbins et al. In the journal Headache in 2016. I'm quoting from an abstract on that article. Background cluster headache, the most common trigeminal autonomic cephalgia, is an extremely debilitating primary headache disorder that is often not optimally treated. New evidence-based treatment guidelines for cluster headache will assist clinicians with identifying and choosing among current treatment objectives. In this systematic review, we appraised available evidence for the acute and prophylactic treatment of cluster headache and provided an update of the 2010 American Academy of Neurology Endorsed systematic review. Methods. Medline, PubMed, and Embase databases were searched for double-blind, randomized controlled trials that investigated treatment of cluster headache in adults. Exclusion and inclusion criteria were identical to those utilized in the 2010 American Academy of Neurology review. Results and recommendations. For acute treatment, sumatriptan subcutaneous, zolmitriptan nasal spray, and high-flow oxygen remain the treatments with a level A recommendation. Since the 2010 review, a study of sphenopalatine ganglion stimulation was added to the current guideline and has been administered at level B recommendation for acute treatment. Other newly evaluated treatments since the 2010 guidelines have been given a level B recommendation, such as deep brain stimulation. There were negative studies that didn't really work. The FDA has not recommended that triptans be used for cluster headache, and without FDA indication, triptans are covered, are not covered. Oxygen is not covered mostly. It has a problem with private insurance, as mentioned above. Have clinical trials for oxygen treatment been done using oxygen? Well, Cohen et al. Wrote an article on high-flow oxygen treatment cluster headache in the JAMA in 2009. These researchers looked at 57 patients with episodic cluster headache and 19 with chronic cluster headache for their analysis. They concluded that cluster headache patients who inhaled high-flow oxygen therapy at the onset of symptoms were more likely to be pain-free after 15 minutes than patients who took a placebo. Peterson et al., writing in Cephalgia in 2014 on oxygen treatment of cluster headache, a review said that their conclusion was oxygen therapy can be administered at different flow rates. 3 studies investigated the effect of low-flow oxygen at 6 to 7 liters per minute and found a positive response in 56, 75, and 82%, respectively, of the patients. One study investigated high-flow 12 liters per minute and found efficacy in 78% of patients. The effect of hyperbaric oxygen therapy has been investigated in a few small studies, and there's evidence only for an acute but not a prophylactic effect. Despite the fact that only a few high-quality studies are available, oxygen treatment is close to an ideal treatment because it's effective and safe. However, sufferers of cluster headache don't always have access to oxygen because of logistic and financial concerns. Are there any useful websites for cluster headache? Check out clusterbusters.org. That has news, drug trials, research articles, and patient resources on cluster headache which would be helpful to an affected patient or his family. And you can also go to ashleyhattle.com. It's spelled ASHLEYHATTELE.com. And she has a great blog, which is a detailed website, which she calls Treatment of Cluster Heads. She's included herself as she has that illness. And I include a good sampling of her blog next because it seems so helpful. And she's also written a book on cluster headache entitled Cluster Headaches, A Guide to Surviving One of the Most Painful Conditions Known to Man. How to Get and Use Oxygen to Treat Your Cluster Headaches, written by Ashley Battle. You know you have cluster headaches. It may have taken years or months to finally have a diagnosis. Hopefully a neurologist or headache specialist already wrote your prescription for oxygen, but even so, they likely failed to mention it not as simple as breathing air. You need a special mask, a high-liter flow, or at least one big tank and several small tanks. One of the best resources for correct oxygen use to abort cluster headaches is found at clusterbuster.org, but an extensive study by Dr. Todd Rosen at the Mayo Clinic, published in Headache in 2010, is an eye-opening resource for how difficult it is for patients to get a prescription, find the right supplies, and use it correctly. She lists that there are 5 aspects to keep in mind as your doctor writes the prescription and you take it to an oxygen supply store, including, number 1, the oxygen prescription. Whether it's your neurologist or primary physician writing the prescription, they will likely get it wrong, which will give you yet another hurdle to jump over. Or worse, they may refuse to write the script altogether. Here's what you can do. Direct them to the well-respected resources of information. There's a 2009 study by Dr. Goldsby et al. That found that 78% of patients using inhaled high-flow oxygen were able to abort 71% to 85% out of 150 attacks. In comparison, just 20% of patients using room air responded, and even then it only worked for 14 to 26% of attacks. The study concluded that there's a significant difference between high flow and room air when it comes to treating cluster headaches with oxygen. That's only one study of dozens. The troubling thing is that Medicaid and Medicare still don't think there's enough evidence, which is another reason why we go to Headache on the Hill each year to try to market that and try to get them to cover it, she says. Encourage your physician to dig deeper and learn more about this mystery condition named suicide headaches. There's a reason why oxygen works. We haven't found it out yet, nor we do know what causes cluster headaches. But we do know there has to be 100% oxygen, at the very least 12 liters per minute. Some patients have found relief with up to 40 liters per minute. However, your physician will probably worry about oxygen toxicity. But unless you have a pre-existing lung disease or issue, you'll be fine using it for 15 to 20 minutes at a time. Come prepared to explain to the doctor that the prescription needs to say what it needs to say to get the right tank set up. This means your oxygen script should say you need at least 12 to 15 liters per minute as needed for cluster headache. That phrasing will help you overcome some of the trouble you'll undoubtedly face at the oxygen supply company and your insurance. Find a new doctor if you try to make your one physician see the facts. It's time to move on to a neurological or headache specialist who knows how to treat cluster headaches. Number 2, the flow rate. The flow rate for your oxygen regulator is another part of the process where you'll most likely face opposition. To avoid this, I suggest buying your own regulators, which can go up to 25 liters per minute or higher on Amazon. When you go through the oxygen company, you pay a rental fee for the regulators, and you'll have to fight tooth and nail for them to give it to you. The 2 main regulators you will need are for the E-tank, which is about 2 feet tall, and often seen being wheeled around, and the M-tank, which is about 3.5 feet tall and sometimes called a J-tank. Some cluster headache patients use a demand valve that ensures consistent flow or a bubbler system to help with the dry mouth. Number 3, the oxygen supply company. This is where the metaphorical headache really sets in. Depending on where you live, you'll either have one choice or several. You can ask your neurologist for a recommendation or go to www.homeoxygencompanies.com to find the company nearest you. As you weigh your options, compare the prices. Some require monthly payment, others make you pay per tank. Remember that your insurance company most likely not cover the cost. Once you pick the company, you'll have to scan a copy of your prescription or bring it in person. Then you can set up automatic deliveries or pick them up yourself each time. Keep in mind that you can go through several tanks a week, depending on the number of attacks, the chosen liter flow, and the size of the tanks. Number 4, the mask. There's a cluster headache mask, and you can go to clusterheadaches.com to find that. Now that you have the regulator and tanks, you need to have the right mask. The oxygen company probably wants to give you a nasal cannula, the one with prongs that wrap around your ears and sits inside your nostrils, which won't work. You need a non-breather mask, which means the mask they may have given you won't work either because it has holes on the side, either side of the nose. You can either tape over those or buy the mask that's specifically designed for cluster headache patients. And there's a name for this. It's called Cluster O2 Kit, oxygen kit. Cluster O2 Kit. You can order that. Search on the internet. Number 5, the tank. I mentioned e-tanks above. They're the oxygen tanks. You see people wheeling around with them to the grocery store. If you're using 15 liter per minute, an e-tank will only last you 35 minutes. It's probably enough for 2 attacks. These tanks should be saved for when you're away from home. You can keep one at work, in your car, etc. Oxygen tank sizes. The M-tanks are the ones you really want. They're hefty and last much longer. All in all, you should have several E-tanks on hand for emergency situations and 2 or more M-tanks at home so you don't run out during a bad bout of attacks, such as an episodic cycle or a high cycle for chronic patients. You can choose to get smaller tanks that fit in the backpack, but they will only last for 1 attack, if that. If the oxygen company delivers the tanks to you, make sure they show you how to set it up. You'll need a special wrench for the M-tank regulator and a separate one for the E-tank. Now you have everything you need and you can start aborting attacks with high-flow oxygen. This abortive treatment has little to no adverse side effects, can be used any number of times a day, and works for approximately 80 to 90% of patients. Some research suggests that you can prolong the length of time between attacks by switching to the nasal cannula for 20 minutes after aborting the attack, in which case you can lower it to 5 liter per minute, use the prongs, and breathe normally again. You can also do this for 20 minutes before bed to possibly prevent a nighttime cluster headache, as cluster headaches usually come an hour or 2 after you go to sleep. The information in this blog is the tip of the iceberg when it comes to cluster headaches and oxygen therapy. There's so much more to know, and if your doctor refuses to learn with you, I highly recommend finding another one. The road to diagnosis is just the first battle, and unfortunately there's a lot of information online about cluster headache treatment. Please scroll past any article that says natural enemies are cure for cluster headaches. Not going to happen. The best information out there can be found at clusterbusters.org and clusterheadaches.com, but there are also fantastic Facebook groups called Cluster Headaches with seasoned cluster heads who can answer your questions based on experience. Learn more about cluster headache and treatment options in Ashley's book, Close Cluster Headaches, A Guide to Surviving One of the Most Painful Conditions Known to Man, which can be found on Amazon and at www.ashleyhattel.com. A brief history of oxygen treatment for cluster headache was given by Ashley Battle. According to the National Headache Foundation, oxygen treatment for headaches was first studied in 1939 when Mr. Charles Reen of Lind Air Products reported to Dr. Francisco Alvarez at the Mayo Clinic that he had successfully treated severe headache patients with pure oxygen. In 1940, Dr. Alvarez released his own study of 100 patients with migraine headache, that's an old term for cluster headache, who were treated with 100% oxygen through a nasal-type mask and flow of 6 to 8 liters per minute, in which 80% of these were reported to be completely or significantly relieved. However, in the 30s and 40s, studies were much less vigorous, and there was nothing to distinguish migraine from cluster headache. Actually, the nosology of cluster headache didn't get worked out until the 60s. Recent work has been done almost exclusively on the effect of oxygen inhalation on cluster headaches, most significantly with Dr. Lee Kudrow, Kudrow, who found that 75% of cluster headache patients he'd studied had their pain relieved by the inhalation of oxygen with increased success the earlier in the attack it is used. How is cluster headache classified? Is it related to migraine? When the first American Classification of Headache was released at the JAMA in 1962. It listed migraine as the main classification of headache, and underneath the name migraine were different types of migraine headaches, such as common migraine, classical migraine, hemiplegic migraine, ophthalmoplegic migraine, and at the bottom, cluster headache. That is, cluster headache was originally listed as a type of migraine, but that was long ago, and now the International Classification of Headache Disorders, first published in 1988, and now called ICHD-3, classifies cluster headache separately from migraine and terms it a trigeminal autonomic cephalgia. Here's the current International Classification of Headache Disorders definition of cluster headache. Okay, they say A, you have to have at least 5 attacks fulfilling B through D below. B, severe unilateral, orbital, supraorbital, and or temporal pain lasting 15 to 180 minutes. C, attack is associated with at least one of the following signs on the side of pain: conjunctival injection, which is eye redness; lacrimation, which means tearing; nasal congestion, which means stopped up nose; rhinorrhea, which means nasal dripping; forehead and facial sweating; miosis, which refers to a small pupil; ptosis, which means upper eyelid drooping; eyelid edema, or eyelid swelling. And then starting with D, the frequency of one every day to 8 per day. Clinical features. During the cluster headache, in addition to pain, the patient may experience symptoms on one side of the face, around the eye, the upper cheek, or temple. So migraine may switch sides even during an attack, but cluster headache is usually pretty much always one-sided. The headaches come episodically, usually on once a year, lasting about 6 weeks, and chronically, that is nearly every day in 10% of patients. The headaches last 15 to 180 minutes, and unlike migraine, where the patients have to lie down because they feel worse being up, patients during cluster attacks have to get up and move around. Cluster headaches occur 1 to 8 times a day, usually coming at night and locking into the clock to occur at the same time every day. Well, why do persons with cluster headache get up and move around? Part of the reason must have to do with the very intense nature of pain with cluster headache. Cluster headache is the most severe of the primary headache disorders, with attacks occurring up to 8 times a day and lasting 15 minutes to 3 hours. The attacks are accompanied by restlessness, anxiety, and agitation, and unlike migraine, the pain is so intense that the individual does not want to lie down and cannot remain still. An interesting article of this was written in Lancet in 1993, Behavior During a Cluster Headache by Blau, who stated, walking with the trunk slightly bent forwards and clutching the head, or sitting and rocking backwards and forwards with the hands pressed on or near the painful site was the most common behavior during attacks. Cluster headaches, wow. So get you some oxygen and get treated on these things. God bless all you folks who had cluster headaches. Thank you for listening. Please click on subscribe, and I'll see you again on the next talk.